Hello, everyone. I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host of this show where we talk about pediatric health topics and answer your questions live. Because of COVID 19 and the safety measures we must all take now to be safe, we're coming to you live via Zoom to maintain social distancing. The COVID 19 pandemic has been emotionally challenging for both children, teens, and adults as people have become more socially isolated from their previous support networks. Today, we will be discussing how families can help identify symptoms that their child might be struggling with their mental health and some ways that they can help support them. Joining us for this discussion is Dr. Stephen Whiteside, a clinical child and adolescent psychologist and expert in the treatment of pediatric anxiety disorders. Dr. Whiteside is a professor of psychology at Mayo Clinic and the director of the Pediatric Anxiety Disorders Clinic. Please send in your questions today about the topic, and we will try our best to review them during the live broadcast today. However, we cannot offer specific medical advice about your individual's family's circumstances. Dr. Whiteside, thank you so much for joining us today.
Oh, it's my pleasure. I'm happy to be here.
I think we should first start by discussing how do we approach having this discussion about COVID 19 and the safety precautions that kids are going to need to start to use as they return to in person learning. And how do you make that conversation different, whether it's a young child versus a teenager?
Yeah, that is a great place to start. I would start off with kind of even a step before that,
Okay.
which is encouraging parents to kind of give themselves a break. I mean, this is a really stressful time. There's a lot of uncertainty. People in charge of things, school opening, et cetera, are dealing with a lot of uncertainty. So parents should not expect themselves to be able to handle every situation uh, perfectly or feel prepared for it. So I think that's a good place for us to start.
Absolutely. And a lot of parents are struggling too as they're trying to manage all
Mhm.
of these plates in the air, and sometimes they fall, and that's just part of life.
Yeah, exactly. And so, in terms of talking with kids, I would begin with on your own, or if you have a spouse or with friends, talking through it and coming up with a plan so that you feel prepared about what you want to say and what you're hoping to accomplish with the conversation. And then the second thing is just in general, just try to stay calm and positive. Because if we are visibly upset and kind of give the impression that we can't handle it, that's going to make kids more upset. That doesn't mean that you can't be upset.
Hmm.
Many of us are, and it doesn't mean that you can't show your children that you're worried. But the important piece is that you also communicate that uh, yes, you're worried, but here's what you're going to do to handle it, and you can handle it, and we will get through this.
I like that.
And then the other thing I would say, just in starting off, is to first listen to what kids have to say, to figure out where they are. What do they already know? What do they think they know that's actually not accurate? And what information do they need?
Excellent. What about in teenagers? Is that going to be a different conversation? I mean, they are more exposed to media and other things, so they may come in with a lot bigger knowledge base to start with.
Yeah, everything that we're going to talk about are just kind of general principles and general approaches that are good for any age,
Okay.
whether they are young kids or teenagers or adult children or just other adults. But the way that you approach it clearly will be different based on the child's developmental level. Um, and with teenagers, they're going to know a lot more, and they also probably have more likely to have kind of been oversaturated, gotten too much information, and have heard rumors and information that's not accurate. And they also might be less likely to trust their parents to be experts on what the parents are saying.
Absolutely. You bring up a good point, kind of sometimes that oversaturation about
Hmm.
COVID and information. It may bring up some feelings of anxiety or fear in children. And so, what would be some of those signs that the family should be looking for that their child might be experiencing some anxiety?
Yeah, probably the Uh, uh, one thing to keep in mind before we talk about specific signs is that everything it's on a continuum from mild to moderate, from things that we would think of as normal or expected to things that have symptoms that have become more extreme. And when we say kind of outside the expected range, it just simply means that whatever it is causing problems. It is
Mhm.
distressing or interfering to a point that the family, the child, and or the parents feel like they can't handle it on their own and they need some support. So that being said, the first thing to look for is changes in behavior, how your child's acting, what they're doing, what they're saying, how they seem to be feeling, how they respond and react to things going on in the family. The reason I started with it, it's on a continuum from more mild to more extreme, is that all of us are changing our behavior. I mean, just we're not going out as much because of COVID, and it's draining. It's taking a toll on people. I've seen this in kind of my practice more often recently. Is kids and teenagers in particular just going displaying behavior you'd expect them to display after they've been cooped up with their parents for a number of months. They
Mhm.
becoming more irritable, they're more arguing at home,
Mhm.
and all of that is normal. It's normal under the best of times, and it's going to happen even more at this point. But I guess when it feels like this is something I don't feel like I can manage as a parent,
Mhm.
or my child, yes, they get angry, but then afterwards, they are throwing things or hitting things, which is very unlike them, or they're spending more time in their room. And in the past, yes, that's pretty normal for a teenager wanting to have their own space, but when we encourage them to come out, they're pretty irritated about it, or just seem like they just don't have the energy or the interest,
Mhm.
or becoming very upset about at small things that wouldn't have upset them in the past. Those would be some of the signs that suggest that they're having more difficulty,
Mhm.
and might benefit from some help.
Absolutely. Okay, so what are some things that parents can do to really help support them with their anxiety and ways that they can help them get the treatment they need?
Yeah. So continuing with kind of the first step would be talking to kids, and kind of we had started off with that, um,
Hmm.
and uh, and so so when you kind of bringing this up with children, this kind of what we're talking about applies to any stressful situation, whether it right now we're talking specifically about returning to school in the midst of the COVID-19 pandemic,
Hmm.
but same thing applies for just talking about COVID-19 in general, or any other changes. If there's a family stressor, there's an illness, separation of parents, anything that's stressful and difficult to talk about. These are there are strategies to go. And I'll talk about some of the steps. And we've at the beginning of back in March, which seems like a couple of lifetimes ago, we put together a website called Anxiety Coach. .com. Excuse me, it's Anxiety Coach at mayoclinic.org. And on there, we have what we call the Family Resource Center. Family, sorry, I forgot the name. I spent so much time making this, you'd think I could be able to remember this quickly.
You got into the details of it though.
I know. The Family Stress Resource Center.
Okay.
And we have steps for discussing stressful events with kids. So it's something that's easily
Hmm.
accessible for parents within and outside of Mayo Clinic.
Hmm.
So when having a conversation, the first, as I mentioned, is to get a sense of what the child is already know and thinking. And part of that is not assuming that our children are responding the same way we are. As adults, especially when parents of young kids, we as adults have a much broader perspective of what's going on. We have more information. We have more of a future-oriented um, perspective. So, kids are mostly, especially young kids, they're thinking about what's happening day to day, and do they get to play, and do they have reading time, or they get to see their friends? And we're thinking about, well, if they don't play with their friends, they're not going to develop social skills, and then they're going to have no friends in high school, and then they're not going to be able to get a job. And so, we're going 20 steps
Right.
down
Right.
the road, and they're not. So things that
Right.
make us really upset and worried, don't bother them.
Hmm.
So we shouldn't assume that just because we're upset and stressed that they
Hmm.
are also.
Yeah, I would say that's definitely true in our family, right? My kids seem completely unaffected. Life goes on, and I'm worrying about the future, right?
Yeah,
Yeah.
yeah. And again, it depends on the child themselves and their age. Younger. Our daughter is 7, and she's going into second grade. And yes, she would like to see her friends more, but she's pretty happy to have more time with mom and dad, and
Hmm.
you know she's pretty self-sufficient and can entertain herself. Whereas friends with toddlers are pulling their hair out, and and friends with teenagers are really struggling trying to get the teenagers to kind of take precautions seriously. So so, back
Hmm.
to what you mentioned earlier, it really does depend on the age and the developmental level of your child.
Hmm.
But in general, you want to be honest and share as much information as appropriate with your kids.
Mhm.
And kind of what appropriate is kind of
Mhm.
a vague term. But in general, you don't certainly don't be misleading.
Mhm.
Don't present things in an inaccurate light or an overly positive light, because there's a good chance that they may find out the truth later, and then it'll be harder for them to hear it from somebody else, and then they'll
Mhm.
be frustrated and upset with you for not leveling with them to begin with.
Mhm.
Um, and also, if you tell them something inaccurate and then they may find out something else that's also inaccurate, that's even worse. So hiding,
Mhm.
keeping things from kids is probably not a good strategy either, but presenting it in a level that they can understand.
Mhm.
Um, and then and you don't have to have all the answers. It's perfectly fine to say, I don't know. And there's really no place I can check, but as soon as I find out, I will let you know, or I don't know, and here's what I'll do to try to find out. And when I find out, I'll let you know.
Mhm.
And then if you can give kids a plan, so give them something to do, whether it's as simple as helping out more at home, which I know exactly kind of many parents' first reaction to that as well. If I suggest that my child do some chores, that's not going to help. But the general idea that they have just being busy, having
Mhm.
structure, and anything that they feel like it can helps them kind of empower them, feel like they've got more control over the situation. So just saying, what you can do is always wear
Mhm.
your mask, and if you need to take it off, make sure you're going in another room or
Mhm.
away from kids, and hand washing and distancing. All little things that they can do, whether it's directly related or indirectly, such as helping around the house, helps them, one, be occupied, and also feel better about what's going on.
Perfect. We have an audience question that I think is perfect for right now. So it comes from B Jones, and she's curious about what are the evidence-based main treatments for childhood anxiety.
Yeah. Yeah, so that's a great question. I'm happy to answer it in a lot of detail. But before we should kind of I think it's really important to make a difference between anxiety disorders
Mhm.
and stress and responding to stress. And
Mhm.
what we mean as psychologists and mental health professionals by an anxiety disorder is when kids are feeling nervous or worried, afraid of something that they don't really need to be afraid of, something that most kids their age would not be particularly afraid of. Um, so if you have, a 2-year-old who's really nervous about, going to bed on their own, that's fairly common, and we wouldn't really consider that a problem. But if you have a 6 or 7-year-old who's really afraid of going to sleep on their own, and there's nothing particularly stressful in life, nothing particularly bad has happened, but other kids at that age are able to go to sleep in their own room. That is when we call it an anxiety disorder. They're afraid of something they don't need to be afraid of. And so we have one set of treatments for that. And on the other hand, are situations where kids may have very similar symptoms. They are feeling nervous and worried and scared and cry more easily and get upset more easily when whatever makes them nervous comes around. But it's pretty understandable that they're worried about it.
Mhm.
So they're stressed out. And most kids their age would respond pretty similarly in that type of situation. And so that's a lot of what we're talking about today is responding to COVID-19 and the uncertainty about how you'll be returning back to school. And it's pretty normal for kids to be concerned and worried and tense about it. And we treat those type of reactions differently.
Mhm.
Uh,
Absolutely.
so in terms of anxiety disorders, and
Mhm.
the treatment is something we call exposure therapy, where we help kids face their fears and learn through their own experience that what they're afraid of probably won't happen. And also they can handle feeling nervous, and they can handle situations not going as smoothly as they wanted. I like to use an example of a fear of dogs. It's pretty concrete and pretty specific. I used to be afraid of dogs as a child. I now have a very rambunctious, annoying dog. So I think I've gotten over it. Um, but so if you're afraid of dogs, you need to pet dogs over and over again until you learn that they're pretty nice and they actually just want to be pet. They don't want to bite you. And that if you stay with them, you can handle that anxiety until it goes down. And we use variations of that for social anxiety and panic attacks and general worries and separation anxiety and specific phobias. On the other hand, when kids are stressed and nervous about something that's difficult to handle, whether it's conflict in the family or a learning disorder and having trouble doing well at school or a pandemic, then we handle it much differently. We don't have people face their fears of bad things that are really happening.
Mhm.
We help them, ideally, we fix the situation, so we reduce the stress, but we help them cope with it through kind of general strategies for kind of healthy behaviors in terms of sleep and exercise and social activities, coping strategies, making sure they have people to talk to, um, things like that.
Okay, so those are things that families can be focusing on during this time of the pandemic, making
Yeah.
sure that their kids are having normal routines and chores and things where they feel empowered. What about, as we start to kids are starting to go back to school, whether it's going to be a hybrid model, in-person model, or remote distance learning model. Um, how can parents help prepare their children? Because a question many children may have is, why can I go back to school now when it wasn't safe for me to go back to school back in March and stuff? So how are things different?
Yeah, and so I think that would, it's kind of the first thing to do is go back to the steps for having difficult conversations with your kids. So first, try to sort that out in your own head,
Mm-hmm.
which may be difficult, depending on where you live, may be challenging, and then uh, talking with your kids. And I would start off with just kind of a general, in a calm and positive way, is just how do they feel about going back to school?
Mm-hmm.
Because again, we don't want to assume that our children are worried about
Mm-hmm.
the things that we're worrying about. And some of them
Right.
may be just completely excited to go back to school, and
Yep.
never occurred to them that there's inconsistency between then and now. And where others might be really worried about it and worried about their safety. So see where they're at, and then try to respond from there and answer the best you can. And just saying, yeah, we're all doing our best. This is something new, and there's a lot of people studying it, and there's a lot of people trying to make recommendations to keep us all safe. And this is what the school has decided, and your teachers and the principal, and this is what we've decided, and this is what we're going to do. And here's the things that we think will keep you safe, and here's what
Mm-hmm.
you can do: hand washing, masks, etc. To handle that. And I wouldn't expect, don't expect your kids to kind of take that in and then, immediately have a formulated response, kind of what their follow-up questions are. They may take a while. They may kind of say, oh,
Mm-hmm.
oh, all right. Young kids or teenagers.
Mm-hmm.
It's a good idea to kind of check back in and a day later or a couple of days later and say, the other day we talked about this. What are your thoughts?
Mm-hmm.
And they might say, we talked about what, when? They might not remember it, or they might have some other idea. And also, especially when talking to kids, it's best to talk when they want to talk. So when you
Mm-hmm.
see them, when they ask a question, and sometimes it's just not convenient because you're trying to work, and
Mm-hmm.
working from home, and then all of a sudden they've got the question. But as best you can, when they want to talk about it, is the time that's most likely to get them to open up.
Absolutely. So that we know that there's risks and benefits with returning to school, and depends on what model. And those are things we've discussed in our previous Facebook lives about COVID and children and return to school. But one, I'd like to get your thoughts about it. Do we know if there's like certain mental health benefits or social emotional benefits from the different approaches to returning to school?
Uh, yeah, so all this, of course, would be speculative.
Mm-hmm.
I haven't personally done a lot of research on how kids return to school after or during a pandemic,
During a global
nor do I
pandemic,
think
yeah.
anybody has. Not to say that there's not research that could inform this,
Mm-hmm.
but I think that um, everybody would like to get back to school, and I think that there are a lot of mental health benefits from going back to school in the traditional way that uh, in-person school.
Mm-hmm.
Um, the school is the kind of the main activity that kids do, obviously.
Mm-hmm.
That's where they get most of their social interaction, and that's one of the education is very important, but learning how to get along with other people, learning
Mm-hmm.
how to function in a group, and have one-on-one friendships or group friendships, and how to handle disagreements, and how to come to a common interest and decide what you're going to do for a group project, or during recess or during lunch, and what to do when someone doesn't want to do what you want to do. It's all really important.
Mm-hmm.
So that is a really important mental health benefit of being at school, for all kids, in
Mm-hmm.
addition to, and also we all feel better when we're doing something um, constructive. We like to have a meaningful life, and we as adults get meaning from many things, but including work, and kids get a sense of satisfaction, accomplishment from learning. Um, and that's also important. Um, of course, you have to balance the risks, which is
Mm-hmm.
not my area of expertise as a psychologist and not an
Right.
infectious disease specialist. But also, the risks of anxiety, and it's more
Mm-hmm.
stressful. And there are going to be challenges such as wearing masks. There'll be
Mm-hmm.
many kids who that's just is really difficult for age-appropriate reasons, just because having something on your face in place is not something that 7-year-olds do very well. Um, some kids are just more sensitive and it's just really uncomfortable. Some kids are more fidgety, and it's going to be hard to keep masks on, and that can be a source of stress
Mm-hmm.
especially if they are worried, or in actuality they get in trouble, or they get called out because they're not, and they get embarrassed. Those could be things that could be difficult. And so on the flip side, doing um, virtual schooling is going to be really hard to have that activity, that social connection, just structure. I mean, structure is so important.
Mm-hmm.
It's going to be really hard, especially for families that have one working parent at home, a single parent, or have both parents working, or it's going to be stressful
Mm-hmm.
for everybody.
Mm-hmm.
Um, that it's going to be hard to provide the structure that we all thrive on
Mm-hmm.
virtually.
So as much structures that they can provide, whether it's making kind of lists for the day of things to go to help them stay on task and stuff. And then one thing I was going to add, I am seeing a lot of kids coming into the clinic that are young, and they're able to wear their mask. And so one thing that families can do to really give their child a good positive step in being able to tolerate wearing masks and getting used to it is really practicing in it. So
Hmm.
practicing it at home, giving them opportunities, letting them explore it and feel it and touch it, or let them be part of choosing the mask or the color or decorating it, and those kind of things that give them a little bit of feeling of control over the situation, and also get their buy-in about how it can be fun. They also can do pretend play and stuff with their stuffed animals or dolls or things like that, where they can also practice doing those safe hygiene measures that we're encouraging all kids to do as they do return to in-person learning, or if they're out in their communities as well.
Yes, those are all good advice.
What about gonna can keep moving on in our discussion. We've talked a lot about anxiety, but I'm gonna want to move on to other things as well. What about just advice we would give to parents, and especially these educators about helping maintain good mental health for themselves as well as their students and their own children?
Yeah, so partly related to that and the last question is another benefit of school is mental health resources.
Hmm.
Schools provide a lot of resources, whether it's lunch or breakfast, or meeting with the school counselor or social work or school psychologist. Um, in terms of general mental health for all of us, um, the our mood, our anxiety is based on kind of our daily experiences to a large extent. That's the thing we can control the most.
Hmm.
And the more you do things that tend to make you feel good, the better you feel. And it's pretty simple and straightforward to talk about, but it's really difficult in the moment when you don't have the luxury of kind of scheduling your own day. And it's also hard when you don't feel up to it. I mean, that's why I have a job, is because when people feel nervous about something, it's really hard to do that thing.
Hmm.
And my colleagues who specialize in working with kids, teenagers, and adults with depression, when you feel depressed and down, it's really hard to do the things that you used to enjoy because they just don't feel enjoyable anymore.
Hmm.
And the problem is that when you avoid things that make you nervous, you just become more nervous about them. And when you don't do things that you used to enjoy because you feel depressed, then your life is more depressing and you feel worse. So it's really hard to change that. And so uh, we also have in that same family stress resource center, we have information on the different parts that I'm going to talk about of what you can do to kind of help yourself feel better, and some checklists so you can make your own plan of kind of selecting activities that you think would be most likely to fit with your life. So things that we can do are um, taking care of our physical health. Everything's worse and when you're not eating and sleeping well. So the more that you can keep a good, get exercise and eat regularly and reasonably healthy, and get good sleep, the better you will feel equipped to handle things during the day. Um, Secondly is social activity. We're by nature social beings,
Mhm.
and we don't really kind of recognize that, I think, as much in day-to-day life, because it's just such a just baked into the normal day is contact interaction with other people. And Zoom is wonderful to maintain those contacts, but it's not the same. I think we're all
Mhm.
getting a little zoomed out. And so making sure that you have, in a safe way, social contact and interactions with people, whether it's your family members, extended family members, or friends. And then third is doing things that make you feel a sense of mastery, a sense of accomplishment, whether that be work or school or hobbies or chores around the house. Just having done something and gotten it done
Mhm.
makes you feel better about yourself.
Mhm.
And then I guess the other piece would be managing stress. Is there's a lot of stressful things in the world at this point, and it's probably not going to help you feel better to read another um, news article about the same thing you've already read two news articles about. So limiting access to news and technology around 15 minutes a day, or kind of checking it once each day if you want. You don't have to. Um, and and then doing other things to, making sure you have time for yourself, and other kind of relaxation strategies and things to make sure you're taking care of yourself and managing your stress.
Perfect. Thank you. Those are helpful. Good reminders for myself as well. Um, let's talk a little bit about depression in children, and more specifically teens. Um, I- it feels anecdotally to me like some of my patients have been struggling more. Is that something that you've also seen, as we've gone through this pandemic for the past 5 to 6 months?
Yeah, anecdotally also, yes, I think so,
Hmm.
and it makes sense.
Hmm.
One of the um, one thing that's happening for all of us is that we can't do a lot of the things that we normally do and that
Hmm.
we enjoy. And
Right.
whether it be team sports or other team clubs, dance activities,
Hmm.
just one-on-one getting together, play dates for your kids or getting together with friends and doing things, we just can't do it. And so
Hmm.
we're just, and the more you're at home, not doing the things that you enjoy, not getting the physical activity that you enjoy, the more you start to feel bad. And if you had already started at a point where you were somewhat depressed or fairly depressed, that really can help it go downhill. Or if you're someone who just has a tendency, we all have tendencies to, we all struggle with different things, and some people are just positive and upbeat no matter what, and some of us tend to get a little bit more anxious about things, and some get a little bit more down and depressed. And if you have a tendency to do that, and then life has kind of been shut down, and there's lots of stressful things, um,
Hmm.
depression can certainly increase in kids, teenagers, and parents.
What would be the symptoms that parents, or the warning signs that they could be looking for that their teen might be struggling, with depression? During this time, we've talked a lot about the anxiety symptoms.
Hmm. Yeah, so the main thing would be withdrawal. So not doing activities, not interacting with the family, just seeming like lower energy, and just not kind of a get up and go to do things. So just
Hmm.
preferring to just sit in their room and just sleep, or just stare at screens, decreased appetite. So just kind of that lower level of activity. Again, some of that is going to be normal,
Hmm.
depending on the developmental level, and wanting to spend time in your room, and technology is pretty addictive for everybody, but kind of a different flavor to it, that is just they've kind of resigned, and they just don't have the energy or interest in doing much.
Hmm.
um, this one may sound kind of funny to say, but decrease in self-care. Now, I know that we are all showering less often and shaving less often and putting on nice pants much less often. Um, but kind of just a lack of interest, or just, it seems like
Hmm.
it's much more difficult just to kind of brush your teeth and keep your hair uh, neat, would be another sign. And then just emotionally, just if they seem sad, if they are just if they're crying more easily, if they're just much more irritable about small things that
Hmm.
never really would have upset them in the past, um, or if they start talking about just being hopeless, that just feel, saying things that makes it seem like they feel like nothing's ever going to get better. There's really no point in me doing this or that, because it doesn't matter what I do, it can't help, I can't fix this, nothing's going to get better. And especially if they say things about wishing they weren't alive, or wishing they were dead, or wanting to hurt themselves.
Hmm. Okay, so as we're nearing the end of our time, I want to make sure that we can give families some tools. So how do they talk to their child about their concerns, bring up their concerns, and who else should they talk to about their concerns about their child so we can help support them and get them treatment if they truly are experiencing clinical depression?
Yeah. So when having that conversation, keep it one again. Have a plan beforehand.
Hmm.
Stay calm and positive and warm, and don't make assumptions. So describe what you're seeing. So say I've noticed that when I ask you to do things that you used to do pretty easily, now you're getting more angry with me,
Hmm.
and you're spending more time in your room. And when we ask you to come out, you get upset. I'm concerned that you're not feeling good. Can you tell me how you're feeling? As opposed to you're obviously depressed. Do we need to get some help? Or kind of assuming how they feel. Teenagers in particular hate to have people assume how they feel. So just describe what you see and that you're concerned, and then ask them to tell you their perspective and what's going on. And then the first place uh, I would, well, so two things. If things are you feel like they're manageable, but you'd like some direction, our website. Anxietycoach.mayoclinic.org is a good place to turn for information about anxiety disorders and also dealing with stress. And this Family Stress Resource Center has things for mood. And then, secondly, if you feel like you need someone to talk to, I would go to your family doctor or pediatrician.
Hmm. Absolutely. And the ways that avenues for mental health treatment has really changed and broadened during COVID. Now that telemedicine is bringing therapy and treatments right into your home without needing to go anywhere. Can you talk a little bit about that and how you can help prepare your child for those telemedicine mental health appointments?
Yeah, that's been a great new addition to the resources and strategies we have for helping people.
Hmm.
And So the advantages of telehealth are probably pretty straightforward. Are one, you don't have to go anywhere. It's easier to keep the appointments.
Hmm.
Takes much less of your time. You can see people who not only you can minimize your risk of going out as well
Hmm.
as inconvenience, but also you can see somebody at a distance who you might not be able to see that provider because they live practice quite a distance from where you are.
Hmm.
Um, the uh, the disadvantages are sometimes it's harder to avoid the distractions of home. If there's other siblings or other noise going on, that can be more challenging. Um, if you haven't, and I don't know how many people there are who have not done this. If you haven't done much Zoom with your child, you might have a Zoom call with a extended family member to kind of get them used to what's going to happen, and just tell them it's going to be like talking to their doctor. The doctor is going to ask some questions. Most of the time, kids and parents are together most of the time, if not all of the evaluation, certainly at the beginning. Sometimes oftentimes the provider will talk with the child individually, but that's
Hmm.
kind of always discussed ahead of time, or should be always discussed ahead of time, and make sure everyone's comfortable with it.
Perfect. Let's end up by talking about a pretty serious topic, which is suicide and teen suicide. And how do parents bring up this discussion and this topic with their kids? Does it increase the risk of suicidal thoughts just by bringing it up? And what ways can parents help keep their child safe if their child is suffering from severe depression and having some suicidal thoughts through means reduction?
Yeah. So if a child is actively suicidal or they're experiencing significant depression, that's
Hmm.
really something that needs to be addressed with their pediatrician and or ideally a mental health specialist to make sure that they're getting the help that they need and that there's a full safety plan. In terms of asking about it, and I would follow the same steps we've talked about before. It's important to talk about,
Hmm.
and I think the risks of missing um, kids being suicidal far outweighs any risk that talking about it would give them ideas that they haven't had
Hmm.
before. So talking about it again, approaching it, here's what I've seen. Can you tell me how you're feeling?
Hmm.
And just say, when you said this, it made me concerned that you were having thoughts about wishing you weren't around or wishing you weren't
Hmm.
alive. You kind of ease into it that way, so you don't have to jump to. Are you thinking about killing yourself? You can say,
Right.
have you been having
Right.
thoughts that you're fed up, or you wish you weren't
Hmm.
around, or that you feel like people would be better off without you?
Right.
or that or you want to hurt yourself. And then you can, if the answer to those are yes or kind of maybes, then you can say, well, have you ever had any thoughts about wanting to kill yourself?
Mhm.
Um, and then if they say yes, then it's important to then go seek help,
Mhm.
and making sure there's nothing dangerous around. And guns and firearms are one of the most dangerous things, because if
Mhm.
kids impulsively decide to hurt themselves with those are
Right.
pretty lethal, and you can't really come back from those. As So making sure that those are locked up, but then also making sure medications are out of reach. And if they've been specifically have been doing some cutting or talking about harming themselves with a knife or cutting themselves, then making sure that knives are put away, at least temporarily.
Perfect. Any resources that you would you've mentioned your website, which we will include under the comment section for families, but any other resources that you want to share with families?
And also, all of this information is also on the website in the responding to stressful events crisis management section. But there are phone numbers for the National Suicide Prevention Lifeline, which is 1-800-273-8255, which I think is 273-TALK, and other crisis lines. Also for kind of abuse help and domestic violence, and other resources for general stressors that families may be experiencing.
Excellent. Thank you so much for joining us today and sharing your knowledge about, mental health and anxiety and depression in children and teens. I think this has been a valuable and educational opportunity for everyone, including myself.
I'm happy to be here. Thanks for having me.
Thank you, everyone, also who watched and joined and sent in questions. We want to encourage you to continue practicing safe social distancing and safe hygiene, washing your hands, making sure you're wearing a mask. Thank you, everyone, and have a wonderful day.